I want you to treat me. Okay.
Mm.
So I am a guy who had myopia for almost like 25 years, 30 years.
Yes.
And now I have developed presbyopia.
Okay.
Okay. So now the glasses that I'm wearing is a progressive glass, as you mentioned, where it has both the power correction, where I look at closer, my presbyopic correction comes. When I'm looking at the distant, myopic correction comes.
Mm.
And I have been thinking about LASIK for a long time. If I come to Center for Sight,
Mhm.
what will be your recommendation?
My recommendation would be that it's a great procedure. You can definitely go in for
For LASIK.
LASIK,
Uh-huh.
provided your parameters are okay for LASIK. So let me just again just go to the basics.
Yes.
So as I told you that the power of the eye is determined by
please.
two things.
Huh.
That means that once the light goes in, this is the cornea. So this has a power. And the second thing is the lens.
Correct.
Okay. So if you have to bring the the light to focus, this will condense the rays, and then these are all convex, biconvex things. So they will actually bring the light onto focus to the retina. Now, you may have a minus power, you may have a plus power, and you may have a cylindrical power or a combination thereof. That means that you could have a myopia with astigmatism, a pure astigmatism, or a hyperopia. That means the plus power with astigmatism, etc. So what are we doing fundamentally? We are using a laser. LASIK stands for laser
Assist.
in situ keratomileusis. Okay, that means that you are using a laser within the cornea. Kerato means cornea, mileusis means reshaping. So you are reshaping the cornea permanently.
The cornea is the outer surface.
This one, this
the
is
outer
the
surface of the eye.
yeah, this is the cornea. So what you are doing is that the cornea is normally steep in the center. Now, if you have a minus power, that means that your power of the eye is more. So a minus lens has been placed in front of your eye so that the light does not converge to that extent. So what you have to do is that this steep cornea needs to be flattened. Okay, so you are using a laser. This is different from a femto laser to begin with. This is called as an excimer laser. EXCIMER, excimer. So this is an excited dimer. It is a combination of two gases. Again, there are certain things that happen in medical science you don't know. This excimer gas was being manufactured in Ukraine.
Oh.
And with this war, the gas has become so costly. So you have to change these cylinders. So anyway, so we are using this excimer laser to reshape the cornea. Just an interesting fact, discovered by somebody where I am sitting, somebody from Tamil Nadu, Srinivasan, working in IBM in US. Where was it being used? To etch the computer chips. Okay, it cuts so fine that it does not leave any traces, so you can even etch a hair. So this was used for etching the computer chips. And when it was used on the cornea, it did not leave any scar. It's a ablative laser. That means it's a burning laser. It burns away tissue without leaving a scar. So this laser was used on the cornea to change its curvature permanently. So you could alter its curvature by making it controlled, that you have a minus power, you flatten it. You, instead of flattening it like a circle, if you have cylindrical, you say flatten it in an oval manner. That means one meridian cuts more and burns more, the other does. And if you have a hyperopia, that means you want more power, then you burn around the paracentral, so it becomes more steep in the center, so the plus power goes. So this is LASIK. Now the second way you can remove glasses is also by putting in a lens within the eye. Putting in lens for cataract surgery is known, where you are actually removing the cataract and putting in a new lens.
Correct.
But you can use what is called as an implantable contact lens. So instead of a contact lens which fits on your cornea and you put it in the morning or you take it out, the ICL fits within the eye. So this lens, you just make a small opening and push it in the eye and it sits on top of your normal lens. So that again, you can have a minus power ICL, you can have a plus power ICL, and you have a cylindrical ICL. So you are able to take care of the need of glasses by two methods. One is working on the cornea and the second is adding something to the eye that is called as an implantable contact lens or an implantable Collamer lens, ICL.
Okay.
So this is how you would correct the myopia, hyperopia, or you would correct astigmatism.
Follow Center for Sight and post your queries to get answers from the experts.